Hey everyone, so a little update. Yesterday I had the good fortune to have a telehealth visit with who is arguably one of the world's very best ACL surgeons. And this is Dr. Tom Hackett up in the Stedman Clinic in Vail, Colorado. And yeah, I did it via telehealth because of our obvious COVID times, but he had reviewed my MRI and he found a very uncommon meniscus injury. And so I want to explain that a little bit. So what you have in the knee is you have your femur that comes down and sits on top of your tibia, and when it bends it kind of does that. So in the middle you have something called a meniscus, and it is about as thin as a piece of tissue paper. And oh, mine has a tear, which is exactly what's going on with my meniscus. So that sits in there in between, kind of like that. Now what happens is 90% of that meniscus does not have a blood supply. And so commonly when someone tears their meniscus, they go in and they take part of it out, and that's called a partial meniscectomy. And I have had 2 of those already on my left knee. So I had one in 2002 and it was on the inside, or the medial meniscus. And then I had the same thing done in 2006 with a different injury, and again it was on my medial meniscus. Well, what Dr. Hackett found was he found that on my lateral meniscus, he sees a tear in the root of my meniscus. And what this is this is actually where that meniscus attaches onto the bone. So there is a blood supply there, and this is kind of a critical part of the meniscus. And so what you do is you actually go in and you stitch that up. You repair it. So what that means for me is a couple of things. Number one, although my end result will be the same, my recovery will be a little bit slower in the beginning. And what I mean by that is because it's such a delicate tissue and you have those stitches in there, you don't want to re-tear it. And so after surgery, I will be 6 weeks non-weight bearing. And so yeah, for 6 weeks I'll be on crutches and I'll be unable to put any weight on that left leg. But my end result will be the same. So, in fact, it'll be better. I will still be about 5 months out till I can ride my mountain bike, and 9 months out until I can click my ski boots into a pair of skis. But that end result is the same regardless of whether they do a meniscectomy or if they repair the meniscus. It's just in the short term, those first 6 weeks, I'm gonna not be able to bear any weight. But long term, this is excellent news for a couple of reasons. Number one, as I stated above, I've already had 2 different parts of my meniscus taken out. And what happens then is that puts you at an increased risk for arthritis. So that meniscus has a purpose, a very important purpose. And without it, like I said, it puts you at increased risk for arthritis. So the more I can keep in there, especially since I've had parts of it taken out twice before, the better. So I'm super happy that, I have this uncommon injury and that he can repair it. The other benefit is this also pushes up my surgery. So without having this repaired, it puts me at big risk for further injury to that meniscus. And so because of that, Dr. Hackett does think he'll be able to operate in the next 2 to 3 weeks, which is excellent news. Excellent news. And this does explain all of the lateral knee pain or outside knee pain that I'm continuing to have. So it's most likely due to this meniscus tear, although I did have a lot of bone bruises on that outside. So I've got one more hoop to go through. Well, a couple of hoops. So Dr. Hackett has to, he's only allowed to do so many surgeries right now, and he has to petition to the medical director for each surgery that he does. So he will be petitioning based on these findings that he saw. And the other aspect is I happen to have excellent health insurance. And if I stay in network, 100% of everything is covered. So the MRI I had, 100%. ACL brace I'm getting tomorrow, 100%. My scheduled surgery in Durango that was supposed to happen on March 30th would have been covered 100%. But nobody in my network is operating right now. And so the only reason this is going to be able to be done is because I had that uncommon meniscus tear. So what I have to do now, I've already talked to my insurance, is do what's called a gap request. And with that, I have to request that I get in-network benefits for out-of-network providers, since Dr. Hackett is an out-of-network provider. So that is a 2 to 15 day process, which I'm starting today, and fingers crossed everything goes through, and if that's accepted, then 2 to 3 weeks I'll have my surgery, which may not seem super exciting to, start this 9-month process, and just as summer's starting to roll around, or late spring, but this is the next step. And I know a lot of people go without getting their ACL repaired, but for the things that I want to get back to, it really wasn't possible, and with this uncommon meniscus injury, it really isn't possible. So this is the first step, getting that surgery done. So I'm really excited to jump through these final hoops, and I'm also super excited to have the premier surgeon in the world be able to do this surgery. So fingers crossed that everything works out.